Hello, hola, and namaste. I'm Darshana, and I'm going to be your host in this virtual space, Pelvic Gyan, the one thing. I'm a women's health physiotherapist, and I'm hoping to have conversations with a variety of medical and non-medical providers about anything and everything related to pelvic health, from pee, poo, pregnancy, postpartum, sex, pain, and more. This is a passion project to increase awareness and to get the dialogue started. But this is not medical diagnosis or medical treatment. If you have specific health conditions, please reach out to your providers and do not take your medical advice from the internet. Thank you for spending time with me. If you have any questions, comments, feedback, I would love to hear from you. Let's get started. Hello, everybody. This is Darshana, and today we have with us Dr. Sunita Iyer. Hello. I am going to introduce her a little bit, and then I'm going to hand it over to her because I am just so intrigued by all of the things I read about you. So she is the founder and clinical director of Eastside Natural Medicine, but you seem to be a superwoman with multiple hats because she's a midwife, she's a naturopathic physician, she's a teacher, she's a mentor, and she's a very passionate advocate when it comes to trauma, mental health, and just perinatal health. When she's not busy treating her patients, she is, raising the next generation of physicians in the residency program and teaching at Bastyr and University of Washington. And sort of like summary of all that you do is 4 P's I read is perinatal, postpartum, pediatrics, and parenting. So it's sort of like one-stop shop from wanting a baby to raising him. So I'm very excited to talk to you, and I would love for you to start with sort of how'd you do this? Like it's so amazing to have midwifery, naturopathic, all of that together. So,
I mean, a little bit of insanity. So I think there's that. When I was, years ago, over 20 years ago, I was working in Boston. Randomly, honestly, is how I ended up in this position, working with pregnant and parenting teens. So younger parents with a lot of other challenges on their plate in terms of completing their education, their own trauma and experiences that they'd had. And then also just, lifestyle stuff, like how do we actually get on our feet? How do we budget? How do we, get jobs, all those kinds of things. And then how do you also be a teenager at the same time, in addition to becoming a parent. So that was actually kind of what spurred my interest in a lot of these things, and realizing that really if we just had tools to support parents of any age a little more deeply, then people could actually be more successful, or at the very least feel more successful, which makes a huge difference. Yeah. Because we know that in parenting, we're not actually successful all the time or even most of the time, right? It's just more so that the feeling of being successful almost matters more. And that in this situation, I got to provide a lot of support to young parents because, organizations realized that they needed it, but it was, but what I found out is that very few people actually leave facilities or leave providers with any support about how to recover postpartum, how to do postpartum, how to feed. And now there's more breastfeeding resources than there was 20 plus years ago. Mm-hmm. And especially where I am in the Pacific Northwest in the Seattle area. But nobody was really helping people at all with this process. And so that's kind of what got me into it. And then I found Bastyr University had this integrated program of naturopathic medicine and midwifery together. So it was really, I think of myself as, having the luxury of being more like a town doctor that way, where I get to know people well before they ever get pregnant, throughout their pregnancy, postpartum, and then care for their family afterwards. So there's people who I've, been a care provider for almost 15 years, which is super gratifying also.
Yes. I mean, and that's kind of like that creates a deeper relationship where you are influencing decisions through the life. It's one of those like wonderful things to have a town doctor that you can trust, they're they're the next member of your family. So yeah, it's amazing to get
feels like that sometimes. Yeah.
Right. I remember growing up that way because in India, our family doc was like our every person. I feel like I was scared of her a little bit as much as I was scared of my parent because what if she sees me doing something I'm not supposed to do?
Yep.
So it
Yeah.
hit a note with me when you said that, setting people up for a little bit of a success, because
Mm-hmm.
there is a lot that goes into postpartum. And in some ways, we feel like the day your baby is born is the day. That's sort of like some kind of
Mm-hmm.
finish line. And nobody tells you, well, the race just started when you come
Right.
home.
Right.
And we feel like we're done. Like, what next? So
Mm-hmm.
what are some of the common challenges that you see for like these new parents?
I mean, everything. It's one of those weird things that when I put it like this to people, that they realize, oh, okay, that's why this is so hard. When you get a knee surgery or something, they give you 6 to 8 weeks of PT, maybe even 12 weeks of physical therapy, and you get to recover. And everybody understands that you're recovering from this thing, right? Nobody expects you to go do these other things. And then when you come home with a baby, not only are you physically recovering, and to some extent, both parents or all caregivers, whoever's involved, because maybe there's sleep deprivation involved too, and then you're also caring for another human. So I feel like everything becomes challenging, like how to eat, finding a moment to use the toilet, getting a shower, and then also just all the expectations. Really, I think that's the part that is the most challenging for people, is all the ideas of like, how do I do this well? If I do this wrong, there's major implications for this. My child could be messed up for the rest of his or her life. And so people feeling like if they don't get it right in that moment, that they are doing something that can never be corrected. And that is a challenge and a myth that I love to also push back on a lot.
Mm-hmm.
And unfortunately, a lot of those expectations are mirrored in, everything, people's conversations, social media, and honestly, even from the maternity care community, that the way that the conversations happen at discharge. Well, if you don't do this, call 911, or, don't do this to your baby or do this to your baby. And they're like, oh my God, how am I going to remember all that? But I would say the biggest challenge is people's expectations, and which isn't to say that they shouldn't have any, but the folks who tend to have fewer expectations of themselves, as a measure of their success, are definitely the ones who are thriving more than other parents tend to be.
Yeah, it's interesting because every time I talk to patients who have this is their second baby, they are much at ease. And the sentence that they intuitively use is, because the bar was so low. This time,
Yeah,
all I told myself
totally.
is, don't drop the baby, put a diaper on, and you're good. And
Right.
so that's a powerful statement, because the first time, who set the bar high? Did we set it up for ourselves, or is it all of the above? So when we look at that, what are some of the things that you see as a physician who deals not only with moms who just gave birth, but also with new babies, because pediatrics is
Yeah.
kind of in your wheelhouse?
Yeah.
What are some of the, like, don't do A, B, and C, and everything else is fine?
Right.
Other than don't drop the baby, because that's what I tell people.
Right. I was like, don't drop the baby, feed the baby. And this is where, I do a lot of work with people in terms of feeding and breastfeeding support. And I will say that I, as a naturopathic physician and a midwife, I definitely end up with a lot of people in my care who feel very, very, very married to the idea of being able to breastfeed 100% exclusively and be successful, and be one of those people on, Instagram that has, the blissed out look on their face while they're breastfeeding their baby. And like, that happens sometimes. It's also a lot of work. And I think that, when I say, like, if there's a don't do, don't beat yourself up about how you feed your baby. A fed baby is alive and a living baby, and ultimately is a thriving baby. And so don't drop the baby and feed them.
There you go.
Yes, diaper the baby, clothe the baby, but like, honestly, they don't care about clothes or diapers. They had never worn them before. So it's clothes and diapers are really for us, not really for the baby. But yes, please use those. And they also don't care if they're pink or blue or cute or made of bamboo or any of those things. Those are all things that we do for ourselves. And so, like, don't beat yourself up about whether or not your baby is wearing clean clothes. it sounds silly, but like the amount of times that people have apologized to me coming into my office, like, oh my gosh, I'm so sorry. Look, I mean, I look like a mess. My child, I mean, look at this child's clothes. They're disgusting. I'm like, that baby has no idea what clothes even are, let alone if they have spit up on them. It doesn't care. They just want to be held. So I won't say that the holding thing is a don't or a do, because some people also are very touched out postpartum, where like having the baby on their body at all times is really challenging. But one of those things is, you know, when in doubt, hold your baby, you know, don't let anyone talk you out of holding your baby, because there's definitely a lot of that. Maybe less so with, at least from my cultural experience in my family of origin, that holding the baby a lot is very cherished. You know, you should always hold your baby close to you in my family. But a lot of the stereotypical American ethos is put that baby down. You're going to spoil that baby.
Yeah.
So if there's another don't let anyone talk you out of holding your baby.
Yeah.
Literally, people don't go to therapy because their parents held them too much. Or because you were loved too much. Nobody goes to therapy because they were, my gosh, my parents just love me so much.
So much.
They cherished me. Yeah, they cherished me.
But I hear you on those two, you know, different ends, where I feel like patients struggle with like family saying one way and their, you know, their friends who are raising kids in a different cultural background saying the other way. And it's sort of like, do what feels right for you. And you know, for the most part, the baby will tell you. Some babies will just become happy when you hold them, and some babies sleep better when they're not on you. So, you know, absolutely. There's like the baby calls the shots, but it takes a while to accept that because we're so used to calling the shots, right? But
if there's a don't think you're in charge.
Right.
And it's okay, you know, relish the opportunity to not have to be the one who manages this situation. You just sit back and take orders.
No, you're right. Actually, yes, I did that this morning. Yes, I know what that is like. That doesn't change.
It continues forever.
So, I know. So when it comes to like, you know, how we talked about like people are sleep deprived, people are setting these expectations, and that's kind of making us almost feel like a failure because we're so used to have this expectation of what this should look like. How much of that is, you know, hormonal? Like, you know, how, because I sometimes remember going back to my early postpartum days of me reacting or crying or doing certain things, which if you repeat to me right now, I'm going to crawl under a rug because no, that's not me. I would never say that. But I have a spouse who reminds me that I did say that. So what are some of the hormonal things for new parents to be aware of and sort of, I don't know, cut each other some slack for something that's actually biology that's making that new mother say certain things or do certain things or set certain bars for herself?
You know, I mean, it's actually kind of miraculous what happens hormonally and chemically in our bodies, literally with the moment of birth. You know, so progesterone is a hormone that builds up over the course of pregnancy and is very high in pregnancy. It contributes to, you know, for some people, the sleepiness, but also, you know, the like looseness of their joints. There's other hormones involved too, but there's lots of things that progesterone does, but it, you know, it's pro-gest. So, you know, in favor of gestation is kind of what it does. And then when the gestation is over, you know, the pregnancy is over essentially with the birth, then the progesterone levels drop really, really dramatically. And for some people, that is one of the triggers all by itself. I would say especially for people who maybe prior to pregnancy or even during pregnancy might have struggled a little bit with anxiety or a lot bit with anxiety. And then they drop, and progesterone can help with that. It can kind of level that out for some people or take the edge off a little. I mean, progesterone is actually something that we'll use, you know, outside of pregnancy to help people navigate some of their moods related to even their menstrual cycles or hormones otherwise. So then when that drops, a lot of people actually experience anxiety, which can look like, you know, just a lot of worry. It can express itself physically, like rapid heartbeat and just agitation, which, you know, can also relate to irritability. and people feeling more edgy and angry. And then you couple that with being sleep deprived and the decrease in progesterone. Some people can actually, it's not that that situation, it calls for that response, but it feels like the response that comes back, you know, from the person who just gave birth is like, wow, that was a very, very intense, angry, irritable response. And some people even catch themselves like yelling about something or being angry about something. Because think of progesterone as almost being like a subdued influence. And then all of a sudden you've lost this very subdued lid, right? And now it's just a full boil for good reason too, right? Hypervigilance has a purpose in postpartum. You are recovering. And, you know, if you think about this, like just as being an animal, we have to keep our babies alive. So being hypervigilant has a good purpose. So I think sometimes even reframing it for people is good, but just understanding that like there's a reason that these hormones are fluctuating in the way that they are. And that for certain people, if they are predisposed, that it may be more dramatic for them too. That's one of the myriad of hormone changes that are happening. And then your body is like pumping out a ton of stress hormones in response to the birth also, and this changeover with your hormones, but also with the sleep deprivation. So your body's trying to keep going on, for most people, 4 hours of sleep. It depends on family help too. You know, this is a very different factor, again, culturally. I'll just compare the way I did postpartum to my cousins, where, you know, my mom also came to help, but of course I was like, no, my baby's sleeping next. She tried to take my son and have him sleep next to her so I could get more sleep, but I didn't let that happen. But my cousins were much more amenable to that. So, you know, my aunties would take, you know, my cousins' babies with them and sleep next to them for 4 to 5 hour stints, bring them back, let them feed, and then bring them back. And so maybe they'd wake once in the night to feed.
That sounds great, by the way.
It was amazing, right? And my mom actually offered to do that, and I was like, no. Also, keep in mind, you know, I'm a midwife, and I'm very, very well trained in sleep deprivation, so I did weather it a little bit differently than a lot of people do. But your body puts out a lot of stress hormones to keep you functioning, to literally keep you upright, and more importantly, to keep your brain functioning when you've only gotten 4 hours of sleep. So there's also that too. If we think about when we are running from the bear, you know, so to speak, with stress hormones, your body is hypervigilant, alert, and irritable, to the point like irritability serves a purpose too. Like it means that our body is sensitive. Our physical sensations are on alert. Our mental capacity is on alert. You know, I mean, there's reasons for why stress hormones do that to our body. And so those are all coursing through your body too. And then on top of that, there's so many. And then your estrogen levels, which are very high. So that's kind of manipulates. So people born female, like those are the hormones that manipulate your menstrual cycles and are in really high doses when you're pregnant, to have really high estrogen levels. Those drop really dramatically after the birth as well, in response to something called prolactin. And prolactin is a hormone that does exactly what it kind of sounds like, is pro in favor of lactation. So breastfeeding, right? So it's great. Prolactin's in the picture to help make breast milk, but it also means that estrogen levels tend to drop really dramatically. And that can absolutely affect mood. And kind of that like, you know, if people ever have this experience in certain parts of their menstrual cycle where maybe the first half they're in quote unquote better mood, and the second half they might feel a little bit less like that. That's kind of what estrogen does, or the influence that estrogen can have for some people in their mood. Some people's cycles don't fluctuate that way, but a lot of people who have the experience of PMS or premenstrual, you know, dysphoria, it's usually those drops in estrogen level that people are experiencing is kind of almost like depression. And so couple that with the drop in progesterone and the increase of stress hormones, you kind of have a recipe for anxiety, depression, irritability, anger, all of which can be nurtured and supported if we have sleep and lots of people looking out for us. But
Yes.
that
So,
is not
so it
often the
sounds
case.
like your brain is basically a hormone cocktail at that point, and
Yeah.
a lot
Yeah.
of it is sort of survival instinct because you need to be
Mm-hmm.
there so your offspring can survive because your brain thinks like, in that survival mode, and things that you can do are help that person with resources in terms of wherever
Mm-hmm.
they need it, whether that's holding the baby or cooking the meal. But
Right.
at what point as a family member or as the village, so to speak, at what point
Mm.
do you feel like this is not just the hormone cocktail that we talked about? This is
Right.
where maybe talk to somebody, or I mean, of course, if there's something drastic where a person is showing any suicidal tendencies or complete withdrawal
Mm-hmm.
with attachment of the baby, I think that's sort of like common sense where a spouse or another family member or partner feels
Right.
like, okay, we need to call the doctor. But what are some of the subtle signs that we can pick up on early on before we actually go to a
Yeah.
darker mood?
Honestly, I mean, it's subtle, as you said. And so very often, if I have the opportunity to talk to families before postpartum, both the birthing parent and all the support people, partners, family members, friends, is to get some idea of how many waking hours in a day people are experiencing this. It's one thing to have an outburst a couple times a day,
Mm-hmm.
even. And it's another thing to have it be all day long, where it's a constant state of hypervigilance and irritability, which is hard for the person who's experiencing it to even know that that's how they're feeling. So some of the things that I would be concerned about is if the person is absolutely unwilling to put the baby down ever, is unwilling to do any activities that care for themselves and their own body, like feed themselves or bathe themselves, or have someone help them with that. If they're unwilling to get some rest. So there are people coming in to hold the baby, even sit with the baby in the room where the person is going to rest, and that they're unwilling to take those moments to rest. And like I said, it's subtle, and as you said too, that it's wired in us to be that protective. But when people start to become unwilling, it's not that they're already at a point where they are quote unquote in trouble, but that they are really close. They're on the precipice. And those are
Mm-hmm.
really good times for the family to get involved and at least talk to somebody. And it's never a bad time to pull in more resources, is what I often tell people.
Yeah.
You're never going to be harmed by having your safety net be deeper and wider. So if you come and talk to me with the thought that you might be experiencing postpartum depression, anxiety, or mood fluctuations that are really serious, let's talk about it. It is absolutely never a harm. And I think that's the other piece too, is there's so much shame associated with not being able to handle it, with not having mother's intuition, or something like that, and knowing how to do all this flawlessly. And that seeking out for help means that you are in trouble. And people also then sometimes think about, oh, that means that I could end up on medication, which for a lot of people is a really fantastic tool, or that I could end up institutionalized. Like, no, talking to somebody doesn't mean all of those things, but the stigma is there too, culturally for a lot of people, but across the board, because people can often relate to that, maybe from a family circumstance. That's how people talk about it still. Like, oh yeah, she went crazy after she had her baby. Like, or maybe she just talked to somebody. And I think that people think that if they go talk to you, they must be going crazy.
Yeah, I feel like the shame has a big piece to it, and I sometimes, at least in my practice, I see postpartum anxiety a lot more
Uh-huh.
than postpartum depression.
Definitely.
And I'm often the first provider to tell them to talk about somebody. And I'm a physical therapist, but I
Mm-hmm.
sometimes in a session end up being a psychotherapist just because I'm
Mm-hmm.
listening to people. Not that I have any tools or intentions to address that, because I'm just not trained to do that. But what I often hear is shame is the
Mm-hmm.
underlying thread. And so I just wanted to kind of get your views on that in terms of a couple of things I see is
Yeah.
breastfeeding, very touchy topic. Some people, for whatever reason, nobody tells you breastfeeding is hard. There's just this almost thought that it's the most intuitive thing, because your one job in the world is to feed the baby that you brought in the world. And now when that doesn't go as easy or as we thought, there's just a lot of, I don't know if it's guilt or shame or it's combined, but that seems to really do a number on that postpartum anxiety. So is there anything, I would love to get your thoughts on what can we do to support those mothers? Like, what is the literature? What is the clinical pearl there that assures them that you're not, you're not doing, because a lot of times what mothers tell me is they feel like they're doing this lifelong damage because they didn't give their baby the what's the word I'm looking for, the nourishment, but more likely like the antibodies or the immunity. And now, this baby's going to have allergies, the baby's not going to have a strong gut because I failed to XYZ. So what can we tell those moms to put their mother heart at rest a little bit about this topic?
Ooh, that's a tricky one. And I will say I probably see a disproportionate amount of people who are very concerned about that, that their children's immune system won't be fully functional. Their gut will be harmed if they have a sip of formula. And really, none of that is actually true or documented in the research. When we look at guidelines, even from the World Health Organization, they recommend that people breastfeed until the child is 2 years old. But for a lot of reasons. Think about what people are experiencing worldwide versus, and in all sectors of societies and socioeconomic levels and levels of access and resources. That recommendation is made for all people around the world. And of a lot of times, this might be true for you. It's definitely true for me. I'm dealing with people who have significantly more resources than many people do in many places around the world. And that those recommendations are really oriented towards making sure that babies have at least their basics in very, very low resource settings. And so when people get really attached, like I have to breastfeed until 2 or my baby will be damaged, like, no. That is not the premise of that information. That premise is for babies to get their basics where the basics may not be available in any other way. But you have lots of other ways to make this happen. And there is no evidence that those babies are damaged. Like even the World Health Organization shares that breastfeeding your baby 50% and formula feeding 50%, those babies still end up with with antibody transmission, and actually have really good demonstrated health outcomes in terms of when they've looked long term. So that if people, it's really for me a way of reframing for people. If your baby has a bottle of formula or breastfeeding doesn't go exactly the way it planned, like literally any amount of breast milk that you can transfer is going to be helpful to that person, period. Not only are you not doing damage, you're really just adding a bonus. And then the person who gets fed and lives and thrives and eats food, for the rest of their life will also thrive and live. Breastfeeding is one of a myriad of ways we set our kids up for success, but it is not the only way. And I'm with you. I feel like the thing that sets up most of the people that I see for really severe postpartum anxiety and depression eventually, when things kind of come down the other side, is breastfeeding. And people really beating themselves up about the fact that it's hard. And they're navigating all this other stuff like pumps and syringes and supplemental nursing systems and lactation visits and weight checks and what it would be like for them, like if it were just simpler. Maybe not necessarily with breastfeeding, but what if we could pick a way to feed your baby that would take all these other things off your plate in your schedule? What would that feel like? And that's at the point where most people realize that they've made it a little bit more complicated than it necessarily needed to be, and that their baby is still really healthy and well. One of the conversations I had with someone recently was, I was relaying a story with a patient where she was really struggling with breastfeeding and as a result struggling with postpartum anxiety and depression. And she was in my office for a well baby visit. So this is in the realm of pediatrics, but she was also a maternity care client, then moved into sort of the primary care realm. And she had her baby laying there and she just looked at him and she said, I hate this. I hate this. And just started crying. And then I said to her, it's like, that's great. Everybody does at some point. You don't hate him. And I said, I certainly don't want you to hate yourself. So let's find a way that you can like this sometimes. But it's a lie and it's a myth that you love this all the time. It's a lie. And I think nobody had even told her that that was a lie, that she felt her, like, so unbelievably ashamed of herself because she didn't love struggling to care for her baby and struggling to care for herself. Who loves that? But we have
this
this
beautiful
story.
image. Yeah, we have this
Yeah.
poetic motherly bond, and it takes courage to even finally say that out loud, that I'm
Yeah.
not liking this. No.
Absolutely. I mean, when do people ever say, I am loving fighting for my life? Nobody says that in any other realm.
I know. I
People
know.
choose marathons and Ironman competitions and also talk about how much they hate it when they do it. And they do it on purpose, They train for it.
Right.
And yet this thing that brings so many other variables, the variables of another human being, and not knowing what they need, we somehow expect them to just love every minute of it just because they might love that person. And they also don't have to love that person every single minute of the day. Sometimes we associate that person, that baby, with our physical pain and our suffering, our emotional pain and our suffering. And that's how we're wired as human beings, is that when a person is associated with a scenario or literally the physical sensation of suffering, we might not like that person very much. It's totally normal to also not like or love your baby every single second, because when you're suffering and they're kind of involved in that, it's hard to say that they're the cause of that, right? Because they don't know.
Yeah.
That's also how we're wired. That's a normal neural pathway for us to then not like that person very much. And I think that that's something that a story that I love trying to help people retell, is that you can love your child big picture and not love them right now.
Right now.
Or like them right now. And you can also hate this part of doing it.
Yeah.
And still really treasure being able to be this person's parent long term.
Yeah, and I feel like in some ways, not liking your child in the minute is sort of preparing you for parenting, because that happens a lot when they're toddlers. That happens a lot more when they're teenagers. So,
Training's on. Yeah.
I know.
Yes, absolutely. Absolutely. And that's often what I tell people, is this isn't the last time you're
I know, right?
you're not going to like this, or that you're going to maybe associate that person with your mental emotional pain. So, get ready.
So it sounds like there are a lot of things that are inevitable, right? The sleep deprivation, the hormones, the stress, as much as we educate people about breast is not necessarily the best, do what feeds the baby, every person is going to walk into this journey with their own expectations for themselves. That's just the truth, right? So while we can't change what you walk into it with, what are some of the things that are in our control? Like, what can we do? Are there any foods? Are there any supplements? Are there any things that help us kind of, the hormone fluctuations that we talked about, one going down, other coming up? Is there anything that's sort of like the best practices during these times to help kind of not make it such a roller coaster hormonal experience for these new mothers?
There are a handful of things. A big piece of it is, honestly, I always think about prevention. What could we do before, especially with something like birth, where we know it's going to happen, right? Like, we don't always know a car accident is going to happen, or even a chronic disease is going to happen, but we do know that birth is imminent. And so that is the greatest opportunity for prevention, if there ever were one. It's like, this is definitely happening,
yeah.
And in a pretty well-determined timeline. Obviously, some babies arrive a little earlier than planned, but so knowing that, talk with someone well in advance about just your value system. There's a childbirth educator in our community who used to do this thing with flashcards. Write down all your values around breastfeeding, interventions at birth, interventions after the baby's born, some big ticket items that have a lot of emotional charge. And what will your value system, how will your value system adjust? Or how will you adjust or pivot if things don't end up the way you quote unquote want them? So even just doing an exercise like that beforehand, and getting clear on what your value systems are. Because a lot of people don't realize that they're putting so much pressure on themselves around expectations and how much that's contributing to their suffering until they're already in it. And again, this is literally one of the greatest opportunities for prevention that we'll ever get, because It's really the only known outcome of
Mm-hmm.
almost anything else in life, despite the fact that it feels out of our control. And then, postpartum in terms of recovery, I mean, obviously having people who like having a safety net, having people who are actually helpful. And I say this to people all the time, like the folks who are going to just drop by to hold the baby and bring you donuts. Mm-mm. Those aren't the people that are your actual helpers. Figure out who your actual helpers are going to be. Someone who's going to bring nourishing food, food that has some substance to it.
Mm-hmm.
And if that's what they can contribute, right? People who are going to come over and maybe just fold a little bit of laundry so you don't have to look at it, and that won't, affect your mental well-being. Someone who will help hold the baby so that you can take a shower, or feel like you can take a shower, because eventually you learn how to do that while the baby's crying on the bath mat. Things like that, like people who are, so it's part of the prevention piece. But in terms of food and supplements, the blanket answer is it depends. But really a big piece of it is just eating regularly. It sounds strange, but a lot of people they're so busy going from one thing to the next, like they're feeding and then changing a diaper, and then by the time they finish how to change the diaper, and then the baby puked all over their clothes, and they change the outfit, and then it's time to feed again, and in the meantime they've pooped again, and you could do that for 4 hours straight, and never have had anything to eat. So sometimes people put a lot of emphasis on, I should only eat these kinds of foods because, this is the thing that, I'm going to set my baby up right, all of those kinds of things. I want to do it perfectly. And in the beginning, I just tell people, just eat regularly. Even if you have to set a timer on like your Apple Watch or your phone or on top of the oven, just something that goes off every 2 to 3 hours to cue you to feed yourself. Very often people will set it on their phones or their watches to feed the baby, and all these little trackers for baby feeding and postpartum apps that are out there, but they'll forget to feed themselves. And so if they can customize, and sometimes we do this together, then I actually have them add a little field or like something in the note section about what they fed themselves. And that's a big piece of it. And honestly, just making sure that people are getting enough protein and fat. That's probably the hard thing, is that when they're feeding themselves regularly, what's easy is like crackers, little junky snacks in bags, bars, things like that. But just thinking about like, what can we put in containers into a refrigerator that actually has a little bit of protein. So whether it's going to be like chickpeas or pepperoni, or depending on whether or not people eat meat or not.
Mm-hmm.
Or if people eat cheese or just something like that they can grab quickly, and even potentially one-handed, and even like logistically, like how can we set this up in your in your refrigerator in a way that you can literally like pull open the door with your elbow, if you're holding and feeding a baby, reach in, grab something, shove it in your mouth, and walk away. This is assuming that people don't have help, and again, culturally, this really depends. Stereotypically, in the way that people do postpartum in the United States, is that they're doing it alone. There's no one home with them. So the person is home alone all day, very often for 12 hours, completely isolated by themselves with a baby. And so there's no aunties, there's no mother, grandmother, there's no partner, and very few people actually have paid leave. So that's how most people are having to function. So a lot of it is really just figuring out the logistics of how they're going to feed themselves than the content. And then supplementally, it's just keep taking your prenatal as much as you can. In fact, I will often tell people, if there's a way to like grind it up and stick it in their food, have someone, like whoever's preparing the food, like here, just mash that up and stick it in there, just so that it's one less thing that
one less thing to do.
Yeah. And then B vitamins in particular. So B vitamins are really, and when I say B vitamins, we're talking about B1, B2, B3, B6, B9, B12. So, B9 is folate. And all of those help with the metabolism or the breakdown of all of our hormones. So when we're talking about progesterone, estrogen, prolactin, all the stress hormones, they all require B vitamins for their formation and their breakdown. So when we're going through periods of intense stress, which is what postpartum recovery is, coupled with the sleep deprivation, we actually have a higher demand for B vitamins. And it is possible to procure some of that from a diet that contains animal products, but not even as much as we would need for people going, even people who eat meat, who are omnivorous. Even their regular diet will typically not contain enough for them. And then on top of that, people who tend to have vegetarian, vegan diets will absolutely require some B vitamins in order to restore what they're using, just simply with the stress, not even necessarily from having decreased availability in the diet.
So is this typically available in your postnatal vitamins, or is this in addition to like a postnatal vitamin supplement?
It is, but very often they need more than what's in the postnatal vitamin.
Okay. All right. So that's a good thing to know in terms of.
I'll usually have people do, if they had anything at all, it's, keep taking your prenatal, postnatal vitamin and a B complex, if nothing else.
Okay.
I'm not a big fan of over supplementing in general. A lot of people want to know all the things that they can take, but that will optimize, but but those are kind of the big ones. And then omega fatty acids are the other, if we're going to add any supplement in. And there's a lot of great research, both clinically and then also, just in trials of having added in omega fatty acids, specifically omega-3s, and their reduction of postpartum depression, and just mood disorders in general. And, think of it as like our brain and our nervous system, it's all coated in fat. And so it is more functional if we have more good fats. All of those little neural pathways, those little highways can function better. And then also our breast milk is fat. So we're also giving it away very, very, very rapidly if we're providing any or a lot of breast milk.
So I'm going to kind of just kind of ask questions about the other end of the spectrum. Because like you said, most of my patients are on the spectrum of how do I feed myself and how many things can I do with one hand, because I don't have somebody taking the baby away from me to, eat. Yeah. And then culturally, I see the other spectrum where people are smothered by all the help they get and they're fighting between what their internet and Google searches are telling them and what is the wisdom that they get, down the line of generations from mothers and aunties and whoever. So have you kind of seen culturally any practices that are almost like with times they are now more myths and they have been kind of there was a reason why they started, and there's a lot of wisdom in cultural practices, a lot of foods that are given to postpartum people. If you really look out, they're rich in certain, things that we need for postpartum healing. So I'm all for it. But then there's that gray area of, okay, we can move away from these practices. So have you seen any things or any kind of quirks there?
Definitely. And all of those practices, I feel like are really, they're rooted in people who just had babies should never eat room temperature or cold food. They should only eat warm or hot food. And then some people will take that further, is that will damage the uterus or hurt the baby. And then about why that might be true. Well, of course you wanted your food to be cooked because there's the potential of transmitting infectious matter to, a newly recovering person. So you definitely did not want to give anyone undercooked or cold food. So just you see this echoed a lot in Ayurvedic medicine, and then people who practice sort of certain elements of that without realizing that that's part of Ayurvedic medicine, and even in traditional Chinese medicine. And there's good reason for that. It was the idea of you didn't want people to eat poorly